asked doctors to answer nursing questions? I know I have, and I'm a nurse. It goes like this. You go with a pain in your knees and you say, "Doctor, what is it? And what am I going to do about it?" Those are doctor questions because what doctors do is diagnose and prescribe. So they do a workup, you come back, the doctor says, "You've got arthritis. The best thing to do right now is lose weight." Now, what's your next question? I know mine would be, how am I going to do that? That is the nursing question. You see, there is a gap between what doctors do, diagnose and prescribe, and what patients need, help with their treatment. That's the space that nursing occupies. Now, it didn't used to be so difficult. We all know that there was a day when doctors did it all. They went to the homes, home visits. They sat at the side of the patients in the hospitals. And the nurses, we all wore white. We had those cute little caps. And we all waited for the doctor to tell us what to do. Well, since then, medical knowledge has ballooned way beyond what any one person can know anymore. And the doctors did the most sensible thing. They started to specialize. So this doctor took the heart, this one, the lungs, the liver, diabetes, cancer. And nurses stopped waiting around for the doctors to tell them what to do. We became the eyes and ears of the doctor at the bedside, communicating the patient's conditions. And as we cared for the patients individually, we realized that they're not the only one reacting to the illness, there's families. And families balloon into communities, a whole new role. I think the patient that taught me the most about this new expanded nursing role was a woman that I met after she'd been discharged from the hospital with a bowel blockage. She'd been struggling with ovarian cancer for quite a while, and the tumor had grown large enough that it had blocked off her intestines and nothing was going through. So in the hospital, she had a tube put down her throat, through her nose. She couldn't eat anything, and they kept her stomach empty because nothing was going through. With some radiation, the tumor opened up a little bit, and she was able to eat again. And they were ready to discharge her. But by this time, they'd exhausted everything. Surgery wasn't going to help. Medicine wasn't going to help. She went home with a certain knowledge that she was going to block up again and come back for more of the same. And she wasn't going to have that. She wanted to stay at home. Now, I knew that she probably didn't understand exactly what that was going to be like. So the first thing I did was sat down and go through the details of how her body would change, the challenges she would have to overcome. And she found this very sobering, but it didn't change her resolve. She was not going to go back to the hospital. So we got to work. We did a lot around pain. She found that if she took enough pain medications so that she didn't hurt, she was asleep. She didn't want to sleep her life away. So we had to find a way between medicines and other ways to keep her pain in a tolerable level where she could still be around. We talked about diet, what she could and could not digest before and after the bowel blocked up. And I even rearrange the furniture in the house, because I knew that there would be a time when she would be too weak to walk about without leaning on things. Now, her husband was having a hard time with all of this. And he coped in the way he usually copes when he is stressed. And he took a long weekend hunting away, leaving her alone in the house. And through her church, we found volunteers to come and stay with her around the clock. And I told them what they'd need to do to be helpful to her. But most of all, what we did was talk. She did a life review, and she talked about her plans for her teenage daughter for after her death. And sometimes I just sat in silence as she grieved. I know I made a big difference in the quality of her life. Just like nurses make a difference in homes and families, communities, clinics, and hospitals all over the United States. So the next time you go to your doctor, you want to ask the doctor questions. What is it? What am I going to do about it? And then you need to turn to the nurse and ask, what's next?